From social distancing to N95s, the coronavirus carries with it a whole new vocabulary. And another phrase you should learn is contact tracing. Contact tracing is finding out all the people who've come into direct contact with someone who's infected. It's important because those people can then be notified that they too might be carrying the virus.
It's one of the key things that we can do to make sure that if those employees develop COVID, they don't pass it on to anyone else.
Dr. Laura Breer is medical director for the Mayo Clinic's Occupational Health Services. With their IT staff, they just developed a high-tech way to conduct their own internal contact tracing. With a centralized database, they create a contact log of everyone who's had contact with a patient or staff member who tests positive for COVID-19. Each of them are then sent a questionnaire to see if they wore protective equipment during the exposure. Workers with medium or high-risk exposures are then sent home, and it all takes less than 2 hours.
So we're trying to catch every single employee before they would present for their next shift if they were potentially exposed.
The state health department does contact tracing for every case by phone. A team of 92 people working 16 hours a day, 7 days a week. They believe doing it voice to voice will continue to be their most efficient way to do it.
We're working with each individual to talk about the type of exposure that they had and what it means for the type of quarantining they need to be doing.
Medical experts see expanded contact tracing as an important element of living with coronavirus until a vaccine is developed. Lou Raguse, KARE 11 News.
According to the state health department, they're able to do all the contact tracing for each case within 24 hours.